Welcome to In the House. I'm Mark Shiver, and so excited to have with us once again Representative Timothy Reeder, Dr. Representative Timothy Reeder, and Pitt County District 9. Representative Reeder, Dr. Reeder, welcome. Thanks for coming back.
No, thank conversation.
Wanted to find out how you're doing. Have you recovered from the fast pace of crossover?
It has been a whirlwind, not just crossover. That was sort of the culmination of several weeks now of being very, very busy. And what I've heard from more senior members is that the pace this session has been really unusual. So I was happy to get through crossover, and I was expecting to be here till midnight every night, but we actually got our work done.
Well, trust me, I've seen those days, and you're fortunate not to have had to endure that for days on end. But now, every session, I think, has its own personality. And I would say this one is just flat out speed. You guys have really been doing a lot. And I think that's credible, actually, commendable in that, you're just getting it done. So good job so far.
Yeah, it's been good.
Yeah. So want to paint a picture. Hospital, emergency room, kind of crowded, late at night, maybe 2 a.m. Some people have maybe been drinking, maybe doing a little drugs. And then there's people there who are with their kids, maybe we're running a temperature, and you're the emergency room doctor on call. Maybe there's several of you trying to take care of these people, and all of a sudden somebody, maybe from a reaction to a drug or maybe a gang related thing, they just go off, they start yelling, maybe they start physically hitting someone or attacking someone, and now you're trying to provide medical care in an environment that's very tense and upsetting. Has that ever happened to you?
Unfortunately, we see things like that very often. And one of the things that we know nationally is that people who work in healthcare, in the emergency department in particular, are at risk for violence and injuries related to that. OSHA put out a report and said that 71% of all of the workplace injuries were attributed to people in healthcare. So all the injuries around the country, 71% of them are in healthcare workers. So it is an endemic. It's bad. And unfortunately, the problem is growing worse. And the emergency departments are where people are oftentimes not at their best. They are suffering from illness and injury, maybe some intoxication. So we see a disproportion of that in the emergency department. And that's why I was working along with other professions in the medical society and the College of Emergency Physicians to introduce the bill 809 on looking at and beginning to address workplace violence.
Yeah, I was looking here, Representative Reeder, and to your point, the Charlotte Observer had a big article recently, a few months ago, I would say, that says, and I'm reading from this now, violence in emergency departments and other hospital settings growing at an alarming rate. But it's not just in large urban centers, but it says across the spectrum, VA hospitals, small rural hospitals, local community hospitals. It seems like none of these facilities are immune from this type of occurrence. And so they use the word alarming. I think it's alarming.
It really is. And when there was a survey of emergency physicians, our college did, 2/3 of emergency physicians had been physically or verbally assaulted in the last year. So 2/3 of my peers. So it is a crisis, and it's endemic. And so to me, it speaks to doing something to address that growing problem.
That's crazy. Now, I'm telling you that right here, sitting in my office, I didn't know this until I began to prepare for our time together. And so I don't think most people are aware that as a physician, you're at risk and you're trying to help people. Now, you mentioned House Bill 809, and that's a good bill. It was passed by the House. It survived crossover we were talking about, and unanimously, I believe. And it says here, I'm reading from a summary, it would enact the Hospital Violence Protection Act to require each hospital with an emergency department to conduct a security risk assessment and implement a security plan. Ensures at least one law enforcement officer is present in the emergency room department at all times. Is this the kind of start you're looking for?
Yeah, the issue is, like many of the things that we deal with in the legislature, is very complicated. And this is really a start. Several years ago, North Carolina passed a statute that if you assault a healthcare worker, it's a felony. And when I started looking at the data and asking questions, over the last 4 years, on average, about 250 people were charged with a felony assault on a healthcare worker, but only about 25 to 30 were actually convicted. So to me, this speaks to, we know that in every emergency department, every hospital across the state, this happens every day. And so we have a problem with reporting, we have a problem with prosecution, we have the whole series of issues. And what I was hoping to do with this bill is to provide some level of security for the staff and for the institution. Related to this, we've seen violence and shootings across. There was just a report last week in the Wall Street Journal, in a medical facility in Atlanta, someone came in and started shooting. And so having sworn law enforcement officers who have the ability to arrest you and carry guns is an important safety measure for these hospitals. And some people have said, well, gosh, is that going to make patients feel uncomfortable if you have law enforcement, if you have people with guns? And what I know from the data is the presence of metal detectors and law enforcement officers in emergency department actually makes patients and their families feel safer than if they're not there.
How about
And
that?
so what this bill starts to do is say, we're going to have some level of security with a law enforcement officer who can intervene if the situation requires. They're armed if there is an active shooter, and they can help begin the process for arresting and charging, gathering those statements to make it easier for staff members who are injured as a result of this violence.
Well, the last time I was in an emergency room, I was in so much pain committing an act of violence. It wasn't anywhere near my thought process. But I'm sure there are people who they, because of other factors, probably primarily drugs or alcohol, get into that frame of mind. So that's not a good thing.
No, and this is the healthcare workers. We can easily differentiate when someone is demented or altered and they're not doing something volitional. So we can help differentiate. This is really to go after the people who are purposely causing violence towards us. So the yelling, the screaming, the threats, or actual physical violence. And many times it's not even the patient. It might be a family member who is doing this. So I think in the healthcare workers, we rely on them to have the judgment to say, this person doesn't have control of themselves, and this person's really being violent and needs to be prosecuted.
Now, let's go ahead and pivot, because you mentioned workers and House Bill 707, another bill that you have brought forth that was passed by the House. It's in the Senate now, and hopefully we'll make it through their process. But it says that would increase the punishment for assault with a firearm on certain emergency, medical, and law enforcement personnel, and increase the punishment for an assault on a legislative, executive, or court officer resulting in serious bodily injury. So assaults on first responders and social workers, that seems to go right along with what you were talking about in terms of incidents in emergency rooms.
Yes, I was really happy to be a primary sponsor on this bill as well. And it continues the theme that you described before, is how are we making sure that we're protecting those people who serve at the front lines? And again, we know as workers, we can differentiate people who are struggling with a medical condition and the people who are just being criminal.
Right.
And so our law enforcement, our first responders, our National Guard, they show up when there's an issue, and we need to make sure that they're protected. And if by raising the penalties for doing this to our first responders, if it makes people think, if it allows us to prosecute these criminals, I was really happy to support this bill.
No doubt. Now, let me ask you a question, and this may be, it's not intended to be a curveball, but it might be. So if you don't know, then that's fine. But I was just thinking while you were answering that question, some cities have decided, because you were talking about people that might be having a mental challenge as opposed to just, being ugly or whatever, wanting to be violent. But some cities have thought about replacing law enforcement with social workers in dealing with situations where you might have a mentally ill person. Do you have any thoughts on that? You might not, but it entered my mind because I don't know if that's a good idea or not. It might be.
What I would say to you is that we know that the problems related to mental illness and substance abuse are huge, and they're getting worse. And unfortunately, some of the tools that we have to address that right now are law enforcement. And so law enforcement may be not well equipped sometimes to deal with someone who's having a psychiatric issue or concern. So I think that we need to figure out how we bolster some of those outreach services. So if someone is having a mental illness crisis, that it doesn't become a criminal problem. But sending social workers or some caseworker out as a first contact in these untenable situations is probably not wise. And I would worry about their safety. And so I think coming up with partnerships with law enforcement and substance abuse or mental illness, I think that is where I would think about and spend time and energy looking to address this problem.
Yeah.
Because I think if you ask law enforcement, they would say dealing with someone who's acutely psychotic from schizophrenia, that they're not the best equipped to deal with that. They have tools at their disposal, but giving medications and talking someone down, that is not what we have trained and asked them to do. So I think we need to think differently about how we integrate those types of interventions.
I think that's an excellent answer, and the partnership would definitely seem like it would make the most sense. In my mind, you don't want to send somebody who has no law enforcement training into a situation that could get violent or out of control, and they might have to defend themselves, and they don't know how. At the same time, as you said, trying to help somebody who might be in the middle of a mental situation where they could be talked down instead of tased or whatever. So yeah, good. So you handled the curveball. Anyway, you've got a couple of other bills here. I just wanted to run by you that healthcare practitioner transparency. What brought that on?
The problem that we're looking to solve, I think when I look at bills, when I've asked to participate, the first question I always come up with is, what are we trying to solve? And what we're looking for in this bill is, particularly in hospitals, if you've ever been a patient, like many people have, you know that all sorts of people come into your room and they ask you questions, they violate your personal space, they're doing things to you, for you, with you. And many times patients don't know who that is. Is this my doctor? Is this the nutritionist? Is this the housekeeper? And so what this bill hopes to address is, in one, that people wear badges and identification so that the patient knows who's coming to interact with them. We, in our hospital before COVID, we all wore color-coded scrubs. So if you were in gray scrubs, we knew you're a physician. If you're in black, you're a nurse. Well, when COVID hit, many of us went to the standard hospital scrub. So everybody, from the person who took out the trash to the person who did your surgery, was in the same color of scrubs. So one of the parts of this bill is to help for the patient and families to know who is it that's coming in my room. So that's part of that identification. The other part of this bill is to making sure that when people are in outpatient settings or they're advertising, that the patient knows what kind of credentials, what kind of training the person has. We've had instances where people call themselves a skin specialist, and in the assumption that the patient or client might have is that that's a dermatologist, that they've gone to medical school and they specialize in the skin.
Sure.
Didn't. And so part of this bill is sort of a truth in advertising, so that when people are describing their services, the patients know exactly what it is that they're getting. And so that's the other part of this bill. It's not to prevent people who are duly trained and credentialed to identify themselves, but really to make sure that there's patient understanding of the credentials and training for an individual healthcare provider.
Yeah, I think that's good. I was sitting here thinking while you were describing, and that's House Bill 576, by the way, passed and in the Senate now. You have to be very thoughtful to do what you're doing as a member of the legislature, because, I mean, here in 15 minutes, we've talked about violence in the workplace and hospitals. We've talked about how to best deal with someone who might be in a mental situation. And, do we want law enforcement? Do we want social workers? We've talked about violence against first responders. And now we're talking about in the hospital room, here's the patient. Do they know who they're getting service from? But you have really got to think about the whole spectrum. And I'm sure there's a lot more that we're not going to get to talk about today. But it's amazing. It really is.
Well, one of the things that has made these first couple months for me really just a blast. I mean, it has been incredibly fun up here, is the intellectual stimulation to think about these difficult, complicated problems. And I've joked with people, I know more about the power system and wastewater treatment and sewage than I ever knew before. And so from a very selfish personal standpoint, this intellectual stimulation is great. And so what all of the members try to do is identify people who have special expertise. So in Pitt County, agriculture is the biggest industry. Not agriculture. But what I've come to understand is that we have members who live and work and own farms. And so when there's an agriculture related issue, I can go to Representative Dixon and say, help me understand this complex technical bill and how it affects farmers. And so I think that hopefully for other members, I can be viewed as that healthcare expert who has a little bit of knowledge, and to be able to share that with other folks up here.
Absolutely. Well, I think you're doing a great job. I've heard nothing but good things, and our time has flown by. So I think we'll cut it off right here and get an opportunity to come back another time and pick up some of the other topics. But I wanted to say thank you for being our guest on In the House, and thank you for I think you're doing a great job. So keep up the good work.
Well, thanks very much, Mark. I appreciate the opportunity to talk about this, and my door is always open, and I love giving people tours of the building and showing them around and hearing about the concerns that they have.
Well, good. That's what it's all about, serving your constituents. So thank you, sir, and hope you have a great day.
All right. Thanks, Mark.
All right. Bye-bye.